Hi everyone, this is Dr. Matt Sherwood with Sherwood Spine and Sport, and this is our third video in our series talking about lower back pain as it relates to the golf swing. In the most recent video, the prior video to this, we discussed the most common swing characteristic that leads to lower back pain, and that's the reverse spine angle. So if you didn't see that video, just briefly, that's when we're setting up in our backswing and our trunk is tilted toward our target, and in actuality should be tilted slightly away from the target. The most common causes that lead to the reverse spine angle from a biomechanical perspective is limited rotation in that back hip and also in the thorax. So in the previous video, I went over a seated thoracic rotation mobility exercise that you can do to gain rotation pretty quickly if you're doing it consistently. And in today's video, we're going to be doing it's a related video, but we're going to be going over an exercise that is also going to combine hip mobility at the same time we're working on a rotation. So we can kind of, you're pressed for time, or you just like this one a little better. This is a quick way to kind of get some hip mobility and thoracic mobility in the same exercise. So how we'll do this is we're going to set up in our quadruped position, which is how we start many of our exercises. We always want to make sure knees are directly under the hips, hands are directly under the shoulders, and we want a nice neutral spine. We don't want it curved in, we don't want it incredibly rounded, so nice and neutral. Now, depending on the side we're doing, I'm going to show you on my right side. So this is going to be working my right hip, and we're going to work on left thoracic rotation here. So, or I'm sorry, it's gonna be right thoracic rotation. So we're gonna bring this right foot up, and it's gonna go next to, on the outside of this right hand. That can be hard just getting to that position by itself. What we wanna make sure is similar to that pigeon stretch. We don't want the pelvis to be tilted over here. We gotta make sure we're nice and flat here. No curvature rotation there. We're flat here. And then we're nice and elongated and tall. Already here, I'm feeling a pretty strong stretch in my adductors, so my groin muscles, and then my hamstring. Then what I like to do to get even more length in that hip is I like to imagine I'm pointing my butt straight back. So someone has a rope here and they're just pulling my butt straight back, and that's gonna get some more engagement through this posterior aspect of the thigh. This inside hand, so the right hand next to the foot's gonna come out. And then as we're maintaining our foot planted and we're engaged here, we're gonna rotate our neck and our trunk, reaching the arm up toward the ceiling until we get a nice pull in that mid back. Then just like the previous exercise, we're gonna use breathing to our advantage. So we hold, big breath in, expand the rib cage, and exhale. And on your long exhale, try to get a little more rotation, and then do that again. And more, good. And that's it for that side. And then we would just repeat on the other side. So we bring the left one up here. Nice and straight spine here. Okay, we don't wanna be too rounded so we get tall. Sometimes if you're real stiff here, you can use, like, either do this in front where you can rest your hands on something, or like some little pillows or something like that, because some people, when they bring the leg up, they're gonna be so stiff, their spine's gonna be really rounded, and that's just not an ideal position to work on that thoracic spine out of. Good, so we're gonna start here. This hand goes up. Then we're gonna make sure we lengthen, stick that butt back. We get a nice pull. We're gonna rotate, breath in, exhale, take out more. And then we go back down. And that's it. So that's a good way to get some thoracic mobility and lengthen the hip at the same time. My opinion, the seated rotation mobilization, we did the video before, is probably gonna get you a little bit more thoracic rotation. But like I said, this is a good combo for the hip and the mid back.